Okay, hi, I'm Mary Quattlebaum. Today, Melanie Johnson and Lauren Scheimer and I are going to be presenting to you about the substance cocaine. In our presentation, we're going to give you an overview of the substance. We're going to talk about available interventions for those who misuse the substance or who may be addicted to the substance. We will also talk about the support systems that may be in place for those who do become addicted. And finally, we're going to talk about some psychoeducation for family members and loved ones of those that become addicted. Cocaine was originally grown primarily in South America in the form of cocoa leaves. I know that many of us think of it as the white powder, but obviously this originally grows on a plant, and this originated in South America. Originally, the plant was chewed by the people of South America for stimulant effects. And then once it was determined that there were these stimulant effects for this plant, it was then exported all over the world and used in tonics and elixirs, and it was developed to treat a wide variety of illnesses. You all know about the soft drink Coca Cola, and this is where this drink first derived its name from the coca leaves. And this was actually a primary ingredient in the early recipes for Coca Cola, the substance cocaine. So it was also used to block pain during surgeries. But cocaine is now a Schedule II drug, which means that it has a high potential for misuse. It still can be used in some medical settings, but most commonly, this substance is used illegally. It comes in two forms. It comes in the water soluble hydrochloride salt, which is the white powder that I was talking about that kind of comes to mind when you think about cocaine. This is commonly snorted. And then it also comes in a water soluble cocaine base, which is then heated to smoke. It also can be injected. All of these methods of using cocaine, of course, are illegal. And in 2017, it was being illegally used by over 6 million Americans each year. The article that I read this in stated that each year that number grows by a million. So as of 2021, there are approximately 10 million people actively illegally using cocaine. So once again, in 2017, 6 million Americans admitted to using cocaine. Those are only the ones that admitted. Primarily those people, the main demographic for cocaine use was Caucasians from the South or from the Northeast. And it was widely used in the age range 18 to 25 was the most common age range for cocaine. This included approximately 136,000 teenagers ages 12 to 17 that were misusing this substance. And 867,000 people self-reported information that met the criteria for cocaine use disorder that year in 2016. Approximately 10% of the people, the 6 million, were hospitalized in 2017 due to overdoses. And in 2017, 1 in 5 overdose deaths were from cocaine use, which resulted in approximately 14,000 cocaine deaths in the United States. Okay, so this is kind of a nice little visual of how cocaine affects the body. Initially, the psychological and physical effects can be quite pleasurable for its users. This includes euphoria and increased self-confidence, increased social ability. And these things, obviously lead to the addiction and make the user want to reuse it a second time. However, over time, the physical and psychological effects do worsen and can lead to sadness, withdrawal, and blunted emotions. The physical effects when someone uses cocaine is going to be an abnormal heart rhythm and breathing, sweating or feeling very hot or cold, muscle weakness, nausea, seizures, and even death. We know that can occur with this substance. So in the brain, the substance cocaine actually kind of acts like almost like an SSRI, which is prohibiting the reuptake of serotonin, but this substance is actually prohibiting the reuptake of the dopamine transmitter. So if you look in this image, these little white balls with it almost looks like a little planet with a ring around it. Those are actually blocking the neurotransmitters. And it's preventing the reuptake of that dopamine, which is keeping the dopamine in those synapses longer and creating that intense euphoric effect. So in the normal neural communication, dopamine's released where it binds to the dopamine receptors, and then it's recycled back into the transmitting neuron by the dopamine transporter. But if cocaine's present, then it's going to attach to the dopamine transporter and block the normal recycling process. So that builds up in the synapse, and then there you have that pleasurable effect of the cocaine. Okay, next we're going to talk about substance use interventions. I'm going to turn it over to our next presenter.
All right, I'm going to be talking about substance use interventions, specifically what is effective for those struggling with cocaine use. So the goal of substance use interventions is to establish a significant post-treatment sobriety and a continued mental health healing. So the most effective interventions are motivational interviewing, cognitive behavioral therapies, contingency management approaches, and relapse prevention interventions. Motivational interviewing is designed to increase a client's buy-in. Oftentimes clients are quite resistant to treatment. And so motivational interviewing is a really effective way to resolve any ambivalence they have about their change and any behavior change that they're resisting. Cognitive behavioral therapy treatment is a focus on psychosocial interventions, and it has substantial evidence in its effectiveness for those with substance use issues. And then contingency management approaches are non-drug reinforcers or job-based reinforcements that incentivize those in treatment to maintain their sobriety. So they can have either money rewards or job-based reinforcements that help them pursue their goal. And lastly, relapse interventions are used to educate the individual on their cues, learning what alternative responses are to their cues, as well as educating the client on their cycle of abuse. So the next slide is the cycle of abuse and the cues. So for each individual, the cue is going to look a little different. For some, it might be a social setting. For some of them, it might be a routine of driving home and always having a drink or hitting their substance at the end of a workday. It could be a number of things depending on the individual. And then that triggers an emotion, either overwhelm, self-doubt, a lack of structure. Again, each trigger looks different for the individual. And then that triggers the biological craving. So this is the impulse to stop feeling. And then we move into compulsion / ritual, which is them preparing to use. And then using is the numbing out of feeling. And then we get back up to guilt and shame. And that kind of starts the whole cycle over again. And guilt and shame becomes the new cue for the next cycle. But the purpose of understanding your cue in this cycle is to implement alternative responses to the cue. As you see where the star is, that is where the individual would want to implement a new behavior response rather than just behaving in their normal compulsion. So these could be mindfulness exercises, these could be distraction methods, they could be exercise. Again, those would be determined by the individual, but this would be the time where they would want to implement new coping skills to handle the emotions that they're feeling. You can move on to the next slide. So the support systems that are available for individuals pursuing treatment are either residential, partial hospitalization, intensive outpatient or outpatient, or just weekly therapy. Again, this kind of like depends on the client. Some clients are going to need a higher level of care and they're going to need more support than others. So depending on the morbidity, this kind of affects what options they have and what options they should pursue. For those who are experiencing any trauma or have had past trauma, brain spotting and EMDR are very effective for treating that. So that would be something that they could use in their support system. Group therapy is extremely supportive. It is good for those struggling with substance use to be around people in the same boat as them, so that they can empower each other and have new support systems that are positive. And then when I was doing my research, I came across a support system called the Peer Recovery Support System. This group is not related to therapy, but they provide emotional, informational, and social support, as well as they help individuals set goals and empower each other to achieve them. And then the most common support system would be a 12-step program. We all know about the 12-step programs. These are AA, NA, those types of programs. And these programs emphasize acceptance and responsibility. Many clients have a way higher success rate if they do use a sponsor. So that's something to consider, that you won't have as much success if you don't engage the 12 steps with a sponsor. But this might not be an appropriate level of care for someone, depending on the individual. If they are still in really intense active recovery, this isn't going to provide the structure and the support that they need to maintain sobriety, unlike a residential or even intensive outpatient program. And then lastly is the family support system. Depending on the individual, this might look different, but individual therapy for family members is important for them to process their own feelings as they're trying to be supportive of the individual. Family therapy can be helpful for working through any issues or interpersonal conflict that they're having because of the substance use. And then this also can help them work through any healthy or unhealthy boundaries that they might have. It's important that the family doesn't continue to enable the individual. And so having healthy boundaries is a huge part of being a good support system for the individual who's going through treatment. And lastly, Al-Anon is a support system for family members who've been affected by those with substance use issues and addiction. And so that could be something that families would be informed of if they want to pursue. Next, we are going to talk about psychoeducation for the family.
Okay. As we know, addiction affects every aspect of an individual's life. And for family members and loved ones, it's really important to be educated on the biological, psychological, social, and spiritual aspects of their addiction. So how does, kind of like we talked about before, how does addiction affect the brain? How does it affect their body? How does it affect their loved ones' social life? How does it affect their jobs? And then along with that, what kind of environment does their loved one have to recover in? Some new research suggests that connection is incredibly important for people with addictions. Human beings crave connection. When we're not getting it from other individuals, we often look for a different source of connection. And so that's where we lead to those chemical bonds from substances. Does the individual with an addiction have purpose? Do they feel needed and wanted? Do they have a purpose within their environment? Is it nurturing their sense of meaning in life? And then more than anything, they need to have messages of, you are not alone, I love you, you are not in this alone, we'll get through this together. One of the most important aspects of, sorry, hold on, I'm so sorry. One of the most important aspects of, sorry, I had someone come in the room. Compassion fatigue is very common within family members who have loved ones suffering from addiction. Compassion fatigue is essentially, in layman's terms, when you put so much of yourself into caring for someone else that you start to develop your own traumas from that. Act. This is a list of different symptoms of compassion fatigue, and not unironically, substance abuse is one of the main symptoms. So by helping somebody who is who is already addicted to a substance, you run the risk of using a substance yourself as well. One of the best ways to combat compassion fatigue is self-care. You have to make sure that your own mental health, your own needs, your own health are being met before helping the individual who is addicted. That in and of itself helps you be a better caretaker for your loved one. Stigmatization of addiction is something that we really struggle with in this society. They are kind of given a message that they are a lower form of people. And then that makes them want to isolate even more. Johann Hari in his TED Talk talks about putting barriers between us putting barriers, from between the addicts and reconnecting by this stigmatization, by the lies that we are fed around addiction. And so it's very important that family members and caretakers, loved ones of addicts, that they are aware of the stigmatization. And really that comes back to the message of you are loved, you are more than your addiction. We see beyond the addiction to who you are, and we value you as a person. Go on to the next slide. Some really important areas of information for addiction recovery is continuity of care. If the individual is in some type of individual counseling, or even in a rehab center or somewhat, is the environment that they are going home to conducive to the different types of coping mechanisms that they are being taught within that counseling or within the rehab center. If you have a teenager who is suffering from addiction, and you have a working relationship with the counselor, are you aware of their SMART goals? Are you aware of their treatment goals? And how can you help manifest that within your home? And then if you have a client who you do not have an ROI to speak with loved ones, self-advocacy, how can you help the client discuss ways to advocate for themselves? I need you to stop bringing alcohol into this house. I'm trying to, get sober. What does the addict need for success within their own health, and how can they advocate for themselves? Also, support network. It's very, very difficult to deal with addiction alone. So get involved with the different support networks that Lauren talked about, and how can you help your loved one get involved, or even just be a source of support? What do they need? A really great acronym is HALT: hungry, angry, lonely, tired. These are very key aspects to substance abuse. Within your own home, are there ways that you can minimize any chance of your loved one getting too high? If they're too hungry, if they're too angry, they're too lonely, they're too tired, they're more likely to use than if they are taking care of. Setting strict boundaries comes in with self-care. Are you taking care of your own needs? Are you setting those boundaries with your loved one, saying my needs come first if I am to help you effectively? And then being aware of that addiction cycle that we discussed previously. Do you know your loved one's addiction cycle? Are you able to identify what stage they're in? How can you help them in that stage? And then also realizing limitations. We're human beings, and caretakers can only lead their loved one to the treatment. They cannot force them. If they are not ready to make the change in their life, it's not going to happen. And then not playing the blame game. Don't put that blame on yourself. The addiction is not your fault. You are not the one to blame for your loved one being in this position. You cannot affect their their choices or their own personal decisions. And then kind of going back to the compassion fatigue, being aware of your own personal traumas and triggers, countertransference, being aware of how you are being affected by your loved one, and how you can, again, take self-care and make sure that you are in a good place to help them. Again, a huge thing for helping people with addiction is finding connection and purpose. If you can help connect with your loved one, if you can grow closer to your loved one, help them find purpose and meaning again in life. These are some of the key things that really loved ones need to be informed of. Cocaine addiction is very serious and requires multiple avenues of support. We hope to have provided an informative overview of the substance and appropriate psychoeducation for those potentially seeking support for themselves or a loved one. Thank you. Here's our references.